people coming in. Okay, Deb, good to go.
Righty. Hello, everyone. Welcome. My name's Deb Ranson. Met some of you before. I'm a clinical nurse consultant. Welcome to our 4th episode in our series. This is brought to you by actually our No More Zombie Veterans Group and Derek Pyra and Jason Frost. They have a great veterans group out there. Our presenter tonight again is Robert Collier. Robert has a remarkable career, I'm sure some of you know. About 20 years in that industry, spanning the globe. He's a very much an esteemed keynote speaker. He's an expert consultant as well in endocannabinoid therapies, cultivation, genetics, regulatory proficiency. Tonight's topic, I'm delighted to say that Robert's going to speak about Australian medicinal cannabis products and their delivery methods. So it really will be a discussion around the current products available there in Australia and the exploration of those various delivery methods and those devices, particularly for effective endocannabinoid therapy. So a bit of housekeeping, guys, as always, put your questions in the chat and we will get to those as we can. And also remember, this webinar doesn't constitute to medical advice. Please do seek that from your medical practitioner. So without further ado, I'm sure you're all ready. I'll hand you over to Robert and welcome Robert Collier.
Nice one. Thank you very much, Deb.
Welcome.
Okay, we'll get started. So today we are going to be talking about the different forms of cannabinoid medication available in Australia and the methods of consumption. And as always, hosted in with No More Zombie Veterans. Okay. In Australia, the different forms of cannabinoid therapies that are available for vaporization, oral administration, topical, nasal sprays, edibles, and, bear with me, extracts. Now, when we start out with that, the most common form that we're all very familiar with would be flower. So when we the basic backgrounds of flower, as we've kind of covered in a few other episodes, is it has the highest concentration of cannabinoids is found in the flower. Over 100 different cannabinoids have been reported to be present in different varieties. And each of these varieties produces resin, terpenes, and flavonoids. When flower is being consumed, some of the most popular methods is through vaporization. Having an action, whether that be through a small portable vaporizer or one of those more larger vaporizers. With these, you can actually tune it to the temperature that you would be looking to vaporize your product at, which can help with releasing certain terpenes or cannabinoids into the body in accordance when they're required. Different cannabinoids and different terpenes vaporize at different temperatures. So it's important to understand that your actual vaporization product is to the standard it's supposed to be. The ODC and the TGA have a list of consumer products that are available. And we would highly recommend that you check out the website to see which one of these will be most effective for yourselves. The second most popular method, and it's been around for a very, very long time, is oil. Oil is available in a number of different methods. It can be a full extract, and what we mean by that is by a full spectrum extract. It would have all of the cannabinoids in there, all of the terpenes, some flavonoids as well, possibly, not always, depending on how the extract is actually being done. This also allows us then to create what we would call formulations. So we can put together a specific amount of different cannabinoids and terpenes to create a profile that may be effective for treating certain conditions. This way we can ensure that there's a consistency in the formulation, because every time it's going to be made up of the same cannabinoids and same terpenes. Also, it allows us to then have single cannabinoid varieties available, whether that might be available in a THC, a CBD, a CBG, a CBN. Each of those are made available, whether it is in concentrate oil, a full spectrum oil, or an actual distillate as well. The distillates are usually available in single cannabinoid varieties. They are very effective for when we were looking at high doses of pain levels, is what we have seen they can be effective for. And hence why the benefits are for that and for relaxation. Extracts is probably one of my preferred areas of cannabinoid therapies. The use of solvents and non-solvents to extract terpenes and cannabinoids from cannabinoid flower and trimmings. Now, there's a number of different methods that are used for extraction. So we'll start out with what's actually used when we refer to as solvents. So when we kind of look more at solvents, we kind of focus more on hydrocarbons and alcohol. While hydrocarbons can be very effective for extracting cannabinoids and terpenes from the actual plant itself, if they're not actually cleaned right, they can be, how should I put it, toxic to humans. So they can, depending on where it actually comes from, there is levels as to what's actually acceptable amount of hydrocarbons to be inside a medical product. But as everybody is a little bit different, people's intolerances can vary. And especially if someone has a weakened immune system, we want to be making sure that all of these extracts that are using solvents are as clean as you can possibly make them. Now, one of the most popular methods that has been used for solvents is carbon dioxide, CO2 extraction. Now, it is quite popular. The only problem that we find with CO2 extraction is the last thing it actually wants to pull from the plant is actually the cannabinoids and terpenes. So the waxes and all of that actually gets extracted out first before what we're actually looking for with regards to cannabinoids and terpenes, which then makes it not one of the most effective methods of extraction. Now, when it comes to extraction methods that I'm preferred of, I will always focus on non-solvent extractions. When we look at non-solvent, we would be starting with something like a resin extract. So we would look at a water extraction, for instance, to begin with. A water extraction allows us to remove the resin from the plant, and then we would go along and press out that product afterwards to create more of an oil-like substance. So they're just a few of the methods that we use, and we're going to kind of jump into those a little bit more now. And our first area of focus on is hash. Now, hash has been around for a long time. It is one of the original methods of cannabinoid therapies that has existed for thousands of years. It is one of the more simpler forms of extract, as it has been done with either a beating of the product as to where they would hit it against silk screens. This would allow the resin heads to actually break away from the plant material. And depending then on as to how fine the silk material was, it would gather up the different size resin heads. When we are looking at hash extraction, we would set it into about anywhere from 5 to 7 different layers. Some of those layers can produce a higher cannabinoid content. Some of those layers can produce a higher terpene content. And some of those layers can produce an almost oil-like substance, the same as if it was actually used in a solvent extract. Hash is very, very useful for when you are looking to make edible products out of it as well. Whether you want to do some cooking with it or whether you wanted to add it to food, the hash makes it very, very easy and a very, very deliverable method on that. As to how anyone's preferred method of extraction is and how it would actually be made, my one would be through water extraction would be number one. There's also dry ice is another method that is used for extraction. It is quite good. It has various tolerance. It does not extract out all of the product. If you use a dry ice for too long, you can end up with a kind of a green looking product, and nobody wants that for a hashish based product. It is also then can be created from when it's actually being trimmed. A lot of these more modern trimming units go along and they can actually create some, as it would call, kefir resin as the product is actually being trimmed. While this may not be the most premium product produced, it does allow us to look at as to how these can be put into more types of extracts, not just for an oil or for a resin. It can be used for making an edible or can be pressed into an oil that can be used for making drinks. Or, yeah, the different forms then of extract that we can look at over the periods of times. Some of the most popular extracts that we are familiar with is, number one will be shatter. Shatter is, just like the word says itself, it is a glass-like substance, and it is very, very, when you break it, it shatters. It is usually a high terpene, high cannabinoid extract. One of the most popular methods of its creation is through using hydrocarbons. Butter is another very, very popular extract. It can be used also while using hydrocarbons as well at the same time, while also being used as well at the same time for water extraction and the rest of it. Some of the extracts that are done in that can actually be of a butter-like substance, not to the same level all the time, but depending on as to how the extraction is done, to the level of quality it is done with, you can end up with an almost identical product as you can with a hydrocarbon extract, but obviously you don't have any of the risks with having any residue left over, whether that be butane, hexane, propane, whatever was actually used to make the extract. Nowadays, it is more than likely a combination of these hydrocarbons together. So some of them we find are better at extracting a terpene, some are better at extraction cannabinoid. But either ways, in the long run, we can see the future of this going towards much more non-solvent products due to the safety and efficacy of these products. One of my other kind of favorites would be rosin. Rosin is created a couple of different ways. One of the most popular ways and most common ways is through heat and pressure. So this is where we would use a press. Now, the press could be anywhere from putting on anywhere from 40 to 100 pound of pressure, depending on as to the size of the product, depending on what variety it is, and what terpenes are actually available in there. Now, there's two ways of actually going about a rosin extract. We can, first of all, go forward and make a water hash, so we can, and then decide to press that product. This gives us the most, what would be a good word? The most translucent colors, I would say, where you can end up with a lovely golden, creamy color. And also then we can end up with the white as you're kind of looking at, and almost like a clear color, which is kind of quite popular. It leads us to believe that there is more cannabinoids in there, whether that would be CBG, THC, depending on the color of it, it can give you a little bit of an indication as to what can be the cannabinoid content in there. as I was saying with regards the rosin extracts, the other way about it then is where the flower is just pressed itself. So it is pressed, the oil is squeezed out of the product. It is still another very good method. So it is. But when we're looking at for a refinement to make sure that we have no plant traces inside of it, an actual water hash extraction made into a rosin product is really the preferred method, and to give you a much finer product at the end of the day. Edibles. Edibles is something that's only beginning to start to come into the Australian market. Edibles have been around for a long, long time. It is nothing new. When we look at what is a classification of edibles, an edible is a product that contains cannabinoids that you can eat or drink. It is not to be considered as food and not to provide any nutritional value. Some of the effects with edibles, they can end up lasting a much more longer period of time. They can have an increased effect on some individuals. Now, this can be very effective if we are looking at for the length of time that a cannabinoid therapy will be effective for. Because when we look at some of these flowers and the rest of it that can be consumed, they might last for anywhere from 20 minutes to an hour, maybe a couple of hours. With an edible, it can last for a much longer period of time. This is what can make them very effective for giving you a sustained duration right throughout your day of whatever the medical benefit that you need, as well then as being able to give yourself a top up, as we say. Now, edibles take a lot longer to kick off inside the body compared to if it is a vaporized product, or even if it's a oil dropper that's taken sublingually. We recommend that at least you're looking at edibles can take anywhere from 45 minutes to possibly a couple of hours to kick in. Now, they are also dependable on the actual individual, what their metabolism is working like on that day, as well then as to whether or not they are hungry, if they've taken it before they've had a full meal, or if they've taken it after they've had a full meal. When we look at the attributes of medical edibles, we can see, number one, they're very discreet and convenient. So they are. That's is you can have them in your bag, you can have them with you. It looks like gummies, or they can look like sweets. In other locations around the world, they can be in chocolate bars, energy bars, granola bars, different types of products are available, depending on the individual and depending exactly as to what you would like. Having them combined like with flaxseed and hemp seed and a couple of other healthy seeds like that can be quite beneficial and kind of make them a little bit more, how should we put, tolerable. A lot of edibles do, especially the gummies, can contain sugar, and depending on the individual, this might not be the best form of consumption. So as with all of these, you need to make sure that you always check with your doctor and your prescriber to ensure as to which is best for you, which is going to be most effective for you, as well as then depending on your own health lifestyle. One thing that has been around for a while and we have seen it has been quite beneficial here in Australia is wafers. Wafers are quite effective and can come on very, very quickly. They have kind of a similar onset time to vaping, and they do have a very consistent effect. Now, when it comes to actual wafers, it's not just a scenario where we can put any sort of extract into a wafer. The extract needs to be of a certain consistency for it to be effective for an actual wafer product. Now, when we say that, when we talk about the consistency of different oils or different extracts, you can find that some of them have what we would say larger cannabinoid head size. So when we look at the resin heads that is on the plant, they can be in a much larger size or they can be in a much smaller size. What we have found is when it comes to a wafer extract, it definitely seems to be much more of the smaller size resin heads that to be much more effective and seem to be much more absorbed into the body through wafers rather than large sizes. Now, this could change over time, but as of right now, with the technology that's available, that seems to be the most effective method for wafers. The wafers have been around for a relatively short period of time, considering as to how long other forms of delivery methods have been available. With regards, especially when people might have a inconsistency with the flavor, or they also might not have a problem with eating or drinking, the wafers can be a very, very effective way, especially people that could be having severe pains. For instance, that could be cancer pain that are associated with that, which can cause eating and drinking to be quite difficult. These wafers can be quite effective in that area. As we were talking about earlier on with edibles, gummies are now available in the Australian market. Now, they are small measured doses. They are quite available in various different flavors, different textures. When we look at what flavors are available, usually these are kind of orange, mint, chocolate are kind of a few of the most popular flavors that we've seen before. I'm not saying that all of those are available in the Australian market. As this kind of moves along in time, we should be seeing a much more wide variety of gummies available. But right now, they are an effective method of consumption, especially for people that are out and about in their day. If you might find it a little bit difficult to be able to vaporize a product, or as well, instead of actually having an oil-based product, having a gummy is really convenient, is very discreet, and it can give you the benefits that you need. On account of the actual sugar being inside them, they can allow for a quicker delivery into the bloodstream, which can allow for a very fast uptake of the cannabinoids that are in it. Now, with those, we can put any varied different amount of cannabinoids in there. We can be looking at THC, we can be looking at CBD, CBN, and of course, we can have CBG gummies as well. Now, one of my personal favorite types of extract is actually the cannabinoid infused drinks. Now, I know this is about what products are actually available in Australia, and what products are actually available overseas is quite different. But drinks are going to be available in Australia very, very soon. The reason the drinks are kind of very effective is that, number one, they've got a very fast onset. Number two, it's got an easily measurable dosage amount. And number three, they can be consistent. Now, when you look at that, even with flowers, that we can go, okay, not every gram is the exact same as the gram before. They can be very, very close. They could have almost identical amount of cannabinoids and terpenes in there, but there can be some bit of variance that happens. Now, when it comes to infused drinks, when we look upon it, that it can be delivered in a measurable shot. So we can have a drink that has, for instance, it can be available in little shots. So each pack comes in 10 different shots. Each shot can contain anywhere from 10 to 30 milligrams of your chosen or prescribed cannabinoid, again, whether that be THC, CBD, or CBG. It can be measured out. You take the shot and it is consistent. So each of those shots contain the exact same amount of measurable product that's in each of those. They come in the shot level or they come in the larger bottle. Some of these drinks now just have cannabinoids inside them, nothing else. And a couple of the companies now that I've been working with over in North America, they have actually decided to actually infuse different types of herbs, spices, and the terpenes inside of these drinks. So you're getting your full cannabinoid profile, while you are also getting the full terpenes. Now, different terpenes, when they're actually consumed orally, can have different effects. Some terpenes can be very effective for digestive system. Linalool, for instance, can be very effective for your liver. So depending on what terpenes are in there, these drinks can be a very, very useful method and a very, very consistent form of delivery that we can look at for the future. Me personally speaking, as I've said it before, and I talk about the drinks a lot, I think that this is where the future of medical cannabis should be heading. It is consistent, it is measurable, it takes away odors, it takes away stigmas. We shouldn't have those. But when it comes to people who have never actually consumed or never vaporized a product before, this is one of the preferred methods that I have found that people really enjoy, as well as once we start to talk about it with doctors and the rest of it, they believe it's a very stable method of delivery and a consistent method of delivery. So I look forward to speaking much more about infused cannabinoid drinks into the future, even though they're not available in Australia quite as well as they should be. The drink that is available in Australia at the moment is a cannabinoid tea. Now, cannabinoid teas are very effective once they are produced in the correct way. Now, what we mean by that is that it does not have to be available as an actual tea form. If you have been prescribed flour, for instance, or you have been prescribed a hash or a base product, this can be made into a tea very, very easily. If it's a flour-based product, the first thing you would need to do is you have to decarboxylate the actual flour. Now, what that involves is it means putting it into the oven at around anywhere between 110 to 125 degrees Celsius for about 10 to 15 minutes. Now, this can have an effect, yes. Studies have shown in the past that once you go above 19 degrees Celsius, you can start to evaporate terpenes. This is true. Now, but when we are looking at a delivery method on cannabinoids and some terpenes, other terpenes don't start to evaporate until 100, 150, 200 degrees Celsius. So while you might lose some terpenes in that, you most certainly will not be losing them all. When you then actually have your flour, you've had it decarboxylated, the next thing to do then is to allow that to simmer for 8 to 10 minutes. Now, when we simmer, it's not quite boiling, it's just below the boil. This allows for the full cannabinoid profile to be exited from the flour and to be inside your water-based tea. Now, you can add a fat to this, as in milk. You can also add some other herbs and spices that you might find effective or healthy for you. And this, then you can start to prepare a little kind of a cannabinoid tea that is very much focused to your own flavors, tastes, and effects. Now, once again, inhalation is not for everybody. And when medical cannabinoids and cannabinoid varieties were becoming quite popular, some of the very, very first methods that was recommended by doctors and prescribers around the world was actually to make a cannabinoid tea out of the flower instead of actually inhaling it. It has been a consistent delivery method, and has shown some very, very positive results when used on a consistent basis, provided, of course, it has been decarboxylated beforehand. If you don't, it still has some of its medical benefit, but not the full therapeutic benefit that can possibly be available when it is actually decarboxylated. Now, while we've just been really covering those products today, we are now going to jump back over to Deb, and I'm sure she has some questions for us.
Sorry about that. Just coming back on. All right. So at this minute, I can't see any questions that have popped through. Just let me check. Nobody's got any questions out there. Did anyone raise their hand or have anything to say about any of the products that are out there and available? I mean, it's pretty amazing what is out there for patients. I think the best thing I could say about it is that absolutely, advocate for yourself, get a really good in-depth practitioner in regards to someone who really understands all of those products, or at least got a bit of a grasp around some of the products that are out there, and particularly around your ECS. I mean, and those endocannabinoids that are already present in your own body, it's really good to have a practitioner that understands that. So advocate for yourself. It's pretty much what I can mention around products, and make sure you get a really good practitioner. And if you're not happy, get a second opinion. If you really feel in your heart you're not being listened to, then get a second opinion or do something about it. I can't see any questions come through, Rob, so you must have just stunned them all.
Oh, I can't say that that's too bad. That's quite good at the same time.
Yeah.
It's like, yeah, pretty much with regards it, like, look at, as I know I keep talking about the drinks, but they're out of everything that would be my personal favorite to see into the future, get much more of a hold in the market, as we say. Because when we look at as to what products are available now, it's about 75% of the market is consumed by flower, and then 25 to 30% of the market is made up of absolutely everything else. So really, there hasn't been a full proper examination or a usage around these other methods. Flower is, and look, to be honest with you, I kind of find it interesting, considering the fact that when we look at through ancient civilizations, flower was never really consumed. It's only something that we've started more consuming in the more modern times of endocannabinoid therapies. Before, it was all extracts and essentially hashish and edibles. That was really as to how everything was created when we look back over the last couple of thousands of years. And I can see when we look at markets around the world, like in North America and the rest of it, we can see gradually over the years that, especially in the medical areas, we've had a shift from it being flower-based products to being concentrate-based products. So it is usually for a more consistent delivery method and a guarantee that you're going to get the same product each and every time. Because as you know yourself, that is a kind of an issue in the market at the moment, is ensuring that there's a consistency in the product that you're getting from month to month.
Yeah, that's exactly right. And also, that stock, there's lots of issues always. So you've got to sort of make sure you've got your head around a lot of things as a practitioner. So you keep that consistent benefit going for patients, because nothing worse than not being able to keep that up, and they can get quite desperate with those symptoms. Got a couple of questions, Rob. Are there any products on the market that combine cannabinoids and other substances like functional mushroom extracts? And second part, does combining cannabinoids with other substances change that scheduling?
Well, look, if we were to look at it as regards, with mushrooms, obviously, if it's a psychoactive mushroom, it definitely would be altering the schedule around it with regards to it. Now, if we're looking at other medications that are in there, now, whether it is just a how should I put this now? If it's a herb-based medication or if it's a pharmacological-based medication. If it's herb-based, it shouldn't be able to change it in any way, shape, or form. But if there is other, chemical-derived medications, it would change it, wouldn't it?
Certainly would change the space of all that. And I mean, if you look at flour when it's grown in those actual, big facilities, I've seen some results where it was just one drop of water, two exact same seeds, exact same strains, treated the exact same way under the exact same conditions, but they tried just a touch of water on leaf instead of direct to root system, and actually changed the makeup of that. So it can be just such a small thing in adjustment that can actually change what you're getting. Got another question for you, Rob. Do you know anything about cannabinoid inhalers and capsules/tablets? So I think maybe they're referring to those well, I don't want to say product, but those like inhalers that are quite like your old Ventolin, Salbutamol, and capsule form, maybe perhaps like the Spiriva caps where you punch or something. I don't know, all capsules for cannabinoids. There's no elaboration on that. So do you know anything about cannabinoid inhalers and capsules/tablets?
The cannabinoid inhalers, they've been quite effective in North America, so they have. They delivered like a measurable dose. They are nice and compact and portable. And when we're then looking at the actual capsules, they again kind of fall into the I like to say the kind of edible area, because they are a gel type capsule, which is supposed to break down inside the body relatively quickly. But we also find as well with certain people, these can have a delayed onset. Some people, they can be very, very effective, kicking in a quite reasonable length of time. And other people, we can find it lasts them. It doesn't kick in for anywhere 45 minutes to an hour and a half, depending on the individual, as with most medications. And like I said, with the actual capsules, we can find them quite effective. So I can't say I would be more inclined for capsules or as regards over another method of consumption, but they can be effective. Usually they kind of, for instance, some of the capsules that we were looking at before was for epilepsy, and they contained some other chemicals inside it to allow the body for a quicker uptake. So like for instance, letrozole was inside of some of these, which was then allowed for when the patient was consuming the CBD oil. It allowed it to be absorbed into the body much quicker. And for a couple of those intractable epilepsies, this was the much more effective method of delivery. Not consistently across the board, just in some cases.
Yeah, definitely. I mean, it changes it, doesn't it? I mean, I've got some patients that will, particularly ask for them, but they might be cannabinoid naive. They might have not used anything out there. And I kind of approach it like, well, I mean, it's an individual thing. We've all got feet. We don't wear the same shoes, as I always say. But what I constantly sort of take into consideration is the fact that it's a fixed dose. So when you want to start low, go slow on something, sometimes I worry about that set dosing, whereas when they can dose it by the drop, size of a grain of rice, 0.05 of a mil, it's a little bit easier for them to kind of manage and meet that sweet spot without having a fixed dose and maybe having a bit more than they need, because we all know you've got that sort of approach where, I mean, people can tell me they're smoking 4 grams a day, but they're only getting so much effect out of it, aren't they? So I often wonder, oh, look, maybe we'll look at the oil first and then get that sweet dose, see what that is, and maybe switch over to a cap or something similar. But then you have patients that actually can't digest the oil. There may be a reason why, so there's a lot of variables in that. Like, it's really very individual. And I mean, with that inhaler thing at the moment, especially with vaporization with the nicotine laws and the change, we seem to have been swept up in those devices. And so now particularly, I believe, don't quote me, but I think it is just the Mighty Medic and the portable desktop that are actually legal to be used with the flower. So it has really encroached on that space. But yeah, a couple more questions.
Pretty much, yeah. I was going to kind of include a little bit more on the devices that were acceptable here in Australia. And when we were looking at that the importation of them and all the rest of it, it really is a very, very limited option at the moment. And like I said, like I said, we're not sponsored by anybody. We don't endorse any products in any way, shape, or form.
No.
So in any way, so we can't turn around and say which one is better, but it has to be a certified medical device for it to be properly vaporizing your product to begin with. That's pretty much all I can say on that method. There is a lot of cheap devices you can get in from overseas, and yeah, we certainly can't recommend. You should definitely be trying any of them.
No, I was only mentioning the ones that are TGA approved now because of that clash between that law. There is one more question. How long does the effect last between products? 2 hours to 4 hours. We all got feet. We don't wear the same shoes. That's a pretty hard question to answer. But Robert, you can speak to that.
That's it. As we were saying, we have seen anywhere from 20 minutes to 8 hours, depending on the delivery methods, the cannabinoid profile, the terpene profile. All of that is dependent, and to use your words, we all wear shoes, but we don't all walk the same. That's
exactly.
I'd be kind of along. Yes, when I look at, like, as to what really gives you a much more longer kind of beneficial, when I've spoke to prescribers, as a lot of them have said to me, is what they have found to kind of be effective is an oil is used kind of for a background pain, and then a flower or a vaporization product is kind of used for that breakthrough frame. So we usually kind of have anywhere then in that time period, 20 minutes to 8 hours. What would your take on that be then?
I mean, yeah, some people have come back and said to me, I honestly felt it within minutes. Other people have said they felt nothing for days. Other people have said that actual spot where they felt something change was around 2 hours. Others have said 30 minutes, 45 minutes. It's really so variable. As I say, 12-hour half-life on those products. You know, you've got around 60% excreted in feces, 20 in urine. You got that metabolic pathway. It really depends on weight, individual process, how quick that metabolic pathway is, how much that pathway has been hammered by a lot of other pharmaceuticals. Does it go straight through? There's just so many variables. It's really hard to say, listen, it's going to work for you in 20 minutes. You approach it with that, listen, it could take a couple of hours. So please start low, one drop, sit there and get, especially if cannabis naive, don't go having another drop or another drop because you think it's not working, because it could very well kick in. And at midnight, you are stoned as a ninny on the lounge with 2 chocolate cakes, wondering what the hell hit you, so you really do have to monitor your function, you individually, and even the way you think about things. And yeah, obviously this is no medical advice. So any other questions? Nope. Beautiful. Well, once again, Rob, star, thank you so much. Thank you everybody for attending. Hope it's been well received. Look out for the next one. And once again, not medical advice. Please do reach out to your practitioners. And I hope you've all found it interesting. So have a really great night and a wonderful rest of your week. Thank you.
Nice one. Thank you, everybody, for joining us, and speak to you all again soon.
Thank you. Take care. Bye-bye, everyone.